everyone. Today we will learn spleen meridian of foot Taiyin. Let's have a review about the physiological function of the spleen. First, governing transportation and transformation for food and body fluid. Second, governing the ascending of clear qi. The spleen qi goes upward and transports the essence up to the heart, lung, head, and eyes, as well as nourish the whole body. If the spleen qi fails to ascend the clear or transform and transport the food, the essence will not be absorbed or distributed, resulting in the deficiency of qi and blood. Therefore, symptoms of listlessness, dizziness, abdominal distension, and diarrhea may appear. On the other hand, spleen's function of ascending the clear also associated with the visceral position. If spleen qi fails to ascend or conversely sinks down, symptoms of chronic diarrhea and prolapse of the anus, stomach, and kidney will appear. The third, governing control of the blood. The spleen can keep the blood circulating within vessels. If its function is abnormal in transforming and transporting, it will lead to shortage of the source for generating qi and blood. When qi deficiency occurred, the spleen could no longer control the circulation of the blood and thus may result in bleeding. The systematic relationship of the spleen. The spleen is related to the flesh in body constituent and dominates the four limbs. Chinese character pi refers to spleen, includes two parts. Left side, yue. Originally, it refers to zhou, means meat or flesh. Now it is written like yue. Right part, bei, means humble. Combined as a character P, a spleen function is like an assistant. Spleen function is like an assistant. It is important in transportation and transformation. The spleen opens into the mouth and shines at the lips. When the spleen abnormal, it may manifest to the mouth. The patient may have dry and pale-colored mouth. The spleen associated with the thought in emotion. Too much thinking may hurt the function of spleen. Saliva is the fluid of the spleen. Some children cannot control too much saliva, maybe due to spleen deficiency. The spleen meridian of foot Taiyin. It originates from the tip of the big toe and travels along the border between the red and white skin of the medial aspect of the foot, ascending anteriorly to the medial malleolus toward the medial aspect of the leg. It crosses over and goes in front of the liver meridian of foot Jueyin, liver 8 cun above the medial malleolus, passing through the anterior medial aspect of the knee and thigh, then enters into the abdomen and spleen, its patterning organ, and connects with the stomach. The external pathway of the meridian distributes in the abdomen 4 cun lateral to the anterior midline. From there, it traverses the diaphragm. The external pathway of the meridian distributes in the chest 6 cun lateral to the anterior midline and runs alongside the esophagus. It arrives at the root of the tongue and spreads over the lower surface of the tongue. The abdominal branch of the meridian goes from the stomach through the diaphragm and finally enters into the heart to link with the heart meridian of hand Shaoyin. As spleen meridian finally enters into the heart, This is one reason that spleen and heart have close relationship. In regards to the generation and movement of the blood, when the functions of spleen qi are normal in transformation and transportation, and the production of blood is abundant, it will support the heart and stabilize the emotion. While if spleen and heart deficiency, sometimes caused by overthinking or overworked, syndromes such like palpitation, insomnia, easily feel tired, poor appetite may occur. Disorders of the food Taiyin system. Meridian disorders. Meridian qi disorders. According to Lin Shu Jingmai, spleen qi cannot nourish the tongue, producing rigidity at the root of it. The spleen dysfunction in transformation and transportation will produce vomiting after eating, and epigastric pain, abdominal distension, belching will appear. Spleen qi promotes the absorption of stomach. If the spleen loses its function, clinically, the manifestations of diarrhea, edema, and jaundice will occur. The patient feels better after defecation or flatters, since the stasis qi can be excreted. Still, a sense of heaviness in the body remains all the time, since there is a dysfunction of the spleen in transforming and transporting the body fluids. It will lead to accumulation of dampness and result in the syndrome of heaviness. The spleen meridian is used to treat pain at the root of the tongue, difficulty in turning and moving, inability to ingest food, and frustration. As this meridian enters into the heart, it can also help treat the epigastric pain. If the spleen earth is in deficiency, it will lose the ability to restrict water, leading to the syndromes of loose stool or dysentery, water retention, and inability to urinate or defecate. In particular, jaundice may occur when the color of earth yellow appears all over the body, restlessness, coldness at the medial aspect of thigh and knee, and the immobility of the big toe. These syndromes are all associated with the abnormal conditions on the pathway of this meridian. The collateral vessel disorders. In collateral vessel disorders, the ascending counterflow of qi can produce cholera-like symptoms. The excess pattern presents as acute abdominal pain. The deficiency pattern as tympanitis. For treating, they can use the lower connecting point spleen 4. In major collateral vessel disorders, the excess pattern presents as whole body pain. The deficiency pattern as weakness and flexidity in bones and joints. The major collateral contains the blood of all the collateral vessels. To treat its disorders, we can use the major lower connecting point of the spleen, spleen 21 大包. That's all for today. Thank you.